Cognitive behavioral therapy, or CBT, is a widely used and effective method for addressing various mental health challenges. At its core are our core beliefs, the deeply rooted ideas that shape how we see ourselves, others, and the world. This presentation will explore what core beliefs are, how they influence our thoughts and behaviors, and how CBT helps us challenge and transform these beliefs for better mental well-being. Core beliefs are fundamental ideas we hold about ourselves, others, and the world. They often develop early in life and are influenced by our experiences and upbringing. These beliefs act as mental filters, shaping how we interpret and react to situations. Understanding core beliefs is crucial because they guide our thoughts, emotions, and behaviors, sometimes in ways we're not fully aware of. Core beliefs can be grouped into three main categories. First, beliefs about the self, like I am unworthy or I am capable. Second, beliefs about others, such as people are untrustworthy or others are kind. Finally, beliefs about the world, like the world is dangerous or the world is full of opportunities. Recognizing these categories helps us identify which areas may need attention. Core beliefs act as the foundation for our automatic thoughts, which influence how we feel and act in different situations. For example, a core belief of I am not good enough might lead to thoughts like I will fail, feelings of anxiety, and avoidance of challenges. On the other hand, positive core beliefs can foster resilience and adaptive behaviors. To change unhelpful core beliefs, we first need to identify them. This can involve noticing recurring negative thoughts or patterns in how we react to situations. Tools like journaling or thought records can be incredibly helpful. For instance, asking yourself, what does this thought reveal about my deeper beliefs, can provide valuable insights. Challenging core beliefs involves examining the evidence for and against them. For example, if you believe I am a failure, you might ask, what evidence supports this? What evidence contradicts it? Behavioral experiments, like trying something new, can also test these beliefs. The goal is to replace rigid, negative beliefs with balanced and constructive alternatives. Let's look at some examples. If someone's core belief is I am unlovable, they might reframe it to I am worthy of love and connection. Similarly, a belief like the world is unsafe can be reframed to there are risks, but I can take steps to protect myself. These changes open up new possibilities for thought and behavior. Core beliefs are central to how we experience the world and ourselves. By identifying and challenging unhelpful beliefs, CBT helps us make meaningful changes in our thoughts, emotions, and behaviors. This process fosters greater self-awareness, resilience, and well-being. Remember, change takes time, but it's entirely possible with the right tools and mindset. If you found this video helpful, please like, share, and subscribe to support the channel.